right, so we are here with Dr. Ruth Olmer, clinical psychologist. And so if you want to go ahead and tell everyone your job title.
I'm behavioral health consultant at Community Health in Central Washington.
All righty. And how long have you been in that position?
About 6 months now.
Congrats.
Thank you.
So, as being a person who is a convert to integrated care, but no, somebody who's crossed over from traditional work into the integrated care, was there something that attracted you to the integrated primary care setting?
I would say two things primarily. One was, I think it was fairly obvious in the research that we were reading when we were coming on board. There's a huge part of the population who has missed with traditional therapy. One, we just don't have the numbers to be able to reach every single person who needs assistance. And two, just the sheer access. People don't access traditional therapy as often as you would hope for them to get the assistance with their day-to-day problems. They're much more likely to go see their doctor or not go see anyone at all, depending on, you know, their lifestyle or background, that sort of stuff. But so the thing that I guess drew me to it was that I would be reaching part of that population that was getting missed, and helping further that movement that's getting those people access to care. Okay, so filling the gaps and then also helping transition some individuals who seek that higher level of care. Yes. Okay. The second thing being it's a faster pace of work. I enjoyed traditional therapy. I still think, quite frankly, that it's needed, and I could go back to it, but this is a very fast-paced style of work. I'm a fairly fast-paced individual, and so I enjoy that kind of energized team approach to care.
All right. So you got, I have written down the gaps, the access, the fast pace, all as being, which that kind of goes into the next question about any surprising benefits of working in this type of environment.
I think the thing that surprised me most that I found when I shadowed, so I came down, shadowed you guys, got to actually get my first experience with integrated care to see if it was something I wanted to do, was that it had that team mentality that I had missed before. I mean, I've been in organizations where there are several psychologists, or on a ward where you have a team that are working with all the patients. But this, I mean, it's constant back and forth with the providers and the MAs and the BHCs, all working with the same patient, and coming from a sports background. Loved it. Something I think I've been missing in my work environments ever since.
So maybe you thought there'd be an increase of team, but wasn't really until you got here that you saw how much team was actually going on.
I think I didn't expect there to be as much. I think I expected me sort of like me go into the room, do my thing like you do with traditional therapy. But then when I first got to shadow, as I got into it, saying, man, this is great.
All right. So for making, again, that transition and doing this now for 6 months, maybe highlight a couple of the biggest challenges, and then maybe a little bit of advice to new clinicians who are making that transition for how to deal with those challenges.
So I think one of the most obvious challenges is how do I help make effective change in such a short amount of time now, whereas before I would have 50 minutes for, I mean, anywhere from 4 to 12 weeks, sometimes longer if it's a long-term issue. How do I help this person today? And I think especially for new folks coming into this area, they get caught up in pinpointing what the problem is and getting an intervention that matches that problem exactly.
Okay.
And so my advice for that would be stop looking necessarily for what the problem is. I mean, yes, obviously we have a referral question we need to answer and that sort of thing, but start looking at how do I help this person be well? How do I look at this person as a whole person as opposed to this one diagnostic issue being brought in on? Because the reality is, for each person that comes in, whatever their problem is, there's probably, I mean, minimum like 3 to 5 things that we could do and make some positive change for them. You don't have to find the exact right intervention in that moment. And I think broadening that view of the person helps with that.
All right. So I actually wrote that. I like that. I'm going to steal that from you. But you heard it first from Dr. Olmer. But how do I help this person today? So that's a question that you have in the back of your mind as you're sitting there asking questions. And at a certain point, it gets down to, what can I do for them today?
Right. Especially as you occasionally, maybe more than occasionally, have that patient who comes in who's not ready for the change that perhaps the provider is hoping will be able to motivate them to.
Correct.
Maybe we can't help them make that change today, but perhaps there's something else that if we address that, maybe they would have more energy to devote to their diabetes care or whatever. So just how can I help this person be well today in the context of what the provider has asked me to help them with.
Almost it's like you're getting some buy-in and you're getting it rolling.
Yes.
Getting some momentum. Okay.
Yeah. Another thing I think was probably a difficult transition, and I know other places do this, but I think it's probably more optional in that setting, is the concurrent charting. It's a challenge to get that going, especially when you're used to, if you're in a place where you can choose to do that and say, well, I'll just take time, little extra time after all my sessions are done to write my notes and whatever. In this setting, you'll never catch up. I mean, you just can't keep up with the pace of work not doing that. So my advice is to practice, get into the patient records, slow down if you have to, take the time when you first get into this field to actually make sure you're doing that concurrent charting. Don't just say, oh, I'll do it later and get into a bad habit. Just go for it.
I think that's fantastic advice, to really get the charting down first in the beginning, make that that habit, as we hopefully all know, and then you'll never stray from it if you already have that habit in place. And
the faster you get, you'll wonder how you ever did without it.
Yeah. Well, that's fantastic advice, and really appreciate you joining us, and I guess we will wrap up from there.
Okay.
All right.